Do you struggle with stiff and swollen knees after sitting for an extended period of time? Whether that's a long car trip, a plane trip, or even just a long dinner out with friends. Well, in this video, I'm going to show you a little trick to make your life easier and help you stop limping as soon as you stand up. So, what's causing those knees to stiffen up after prolonged sitting? Now, when you have osteoarthritis, you generally have a whole lot more fluid buildup in the joint, which is part of the pathological process. But when you sit for a long time, fluid in the surrounding tissues starts to build up and pull due to a lack of movement and the effect of gravity pushing that fluid down. That fluid sitting there causes that stiff feeling when you go to get up. But what causes that fluid to disperse and allow your knee to free up? The answer is movement. Now I want you to remember that because it's very important. Now what can we do to kickstart that fluid movement and get you up walking without that limp? So I have two quick exercises that you can do prior to standing up, whether it's under the table at dinner, whether it's in the car or in your seat on the plane prior to standing up. It's going to help with the limping as soon as you stand up. So the first one that you can do is try to get that quad muscle firing and that joint moving through its range of motion. So if we can just do slides, that's great, but ideally we're going to move to the edge of our seat and try and straighten. We're going to get that quad muscle firing. So when it fires, it works to disperse all of that fluid, okay, and move it away from that knee joint. So if you can do about 20 or 30 of these, you'll start to feel that muscle warm up. And then once you finish that, go into just doing some calf raises like this. Now you're getting the backs of your legs firing. Okay, again, if you can do 20 to 30 of these, then try and stand up and see how you feel. Now, these are the strategies to help you manage that swelling when you are out and about living normal life. However, if you want to manage that swelling as well as reduce pain in the long term, then it's best to start a strengthening and mobility program or exercise regime, okay, that works to strengthen those muscles, okay, to support and protect that knee joint. I have plenty of other videos on the channel that show you some of those exercises that you can incorporate into an exercise regime, and they vary from beginner all the way up to more advanced level exercises. Finally, what you need to understand is that to get better and to really manage those symptoms requires consistency on some level. Now, the hardest part to starting any exercise regime is truly the start. And in my opinion, the best way to manage this is through momentum. So, if you think about riding a bike that doesn't have or only has one gear or is in a really high gear, now think about how hard it is to actually start those revolutions. It's so hard to begin with, but once you start to pick up speed, those revolutions become a whole lot easier. Now I want you to bring that back to exercise, okay? So your body has been doing a lot for you, okay, over the years. It's taken you where you've needed to go. It's allowed you to do the things you've wanted to do. So how about say thank you to your body, all right? And tell yourself that each day when you wake up, you're gonna do one thing for that body of yours. Now, that one thing may be doing 6 sit to stands, standing up and sitting down, and maybe doing that twice. Now that will take you about 1 minute. and you've finally done something nice for your body. Okay, you've said thank you. Now, over 2 to 3 weeks, okay, that will start to become easier. You've built that momentum. And after 2 to 3 weeks, you may be able to start by adding another exercise. Okay, so now you're doing 2. And over 2 to 3 weeks, that momentum is going to build up again. And then you can add a 3rd or a 4th. And over time, you're going to start to be going downhill. Okay, that momentum's picked up. And all of a sudden, you've created a healthy exercise regime where you're doing multiple great things for your body. And you're going to start to feel the benefits, okay, to your joints. Benefits that you're going to improve that knee osteoarthritis. It's not going to be as stiff. It's not going to be as painful. You've built the strength that you need, and now you've got better feeling joints, and it's allowing you to do the things that you really want to do. So it's all about just getting started. And to build momentum, you need to start with a small action. Just a reminder that the exercises that you see in this video may not be right for you. So please check in with your doc before starting any of these exercises. Okay, and if it really hurts, I'd stop doing it. So thanks guys for watching. Please check out my new Instagram channel, as I've put up a really good quote about momentum and kind of put what I just said into writing format. So I hope you really enjoyed this. There's gonna be more to come. Have a great day.